Hey everyone, it is Monday Night Spark here on a Friday happy hour edition. In today's Monday Night Spark, we're going to be talking about what is CBD, what is all the CBD talk about. So have you heard about CBD and you're seeing it on signs? I was actually just driving here right now and I saw it on a flashing light sign saying we sell CBD, and you're wondering what CBD is and can it help you? Are you wondering, maybe you heard from someone who said, I've been using CBD, it's been working out great, maybe you should try it, and you're wondering to yourself, what is CBD and can it help me? So those of you that are jumping on here on the live, just type in live. And those of you who are watching this on the replay or you're watching on the Spark Your Training YouTube, thank you very much for watching this video. Ask any of your comments, and those that are going to be jumping on the live, just ask your comments right below into the comment box and we will answer that. So I have a very special guest on today. Laura is a physical therapist with over 20 years clinical experience, and similar to my story, she kind of wanted to get out of the traditional physical therapy setting of just kind of fixing people and helping people and get into more of a wellness model and impact them in a different way. So Laura, if you don't mind giving us a little brief introduction of who you are, where you've been.
Hey guys, Barca Dzialo, PT. I've been a mostly acute care physical therapist for 24 years now, and my background basically was in sports. I was a competitive figure skater for 18 years. I had a few injuries. I did have one surgery from an accident that impacted my athletic career. So I was really around a bunch of athletic trainers and physical therapists while I was, going through college and my training. And that sparked my interest, no pun intended. That sparked my interest in physical therapy field. I had planned on doing specifically sports medicine, and after being in acute care for first 2 years, which is highly recommended for many new physical therapists to get a good clinical base, I ended up loving working with the geriatric population, and 24 years later, I specialize in post-op orthopedics. But I have found in the last year or so many questions about traditional medicine, lots of changes in healthcare, and just looking for addition to what I can offer in my toolbox to patients and family members and friends. So I got into a nutraceutical health and wellness business about a year and a half ago, and I'm really finding wonderful benefit for myself personally. I've had great experience with the products, and I also am finding that I can offer an alternative to many friends and family that have not found what they were looking for as far as their health and wellness with surgeries or prescription medications. So that's kind of why I'm here with Dwayne tonight.
Nice, awesome. So Jennifer's here on the live. How you doing? Julie's here. Stephanie's here. Thanks, guys, for joining. If you are catching this on the replay, just type in Team Replay into the comment box, and if you're here on the live, just let me know. Type in live into the comment box. So the reason why I wanted to bring this topic to a lot of you is because I've been hearing a lot more about CBD, and I personally, honestly, was wondering about it and what it actually does, and can it help some of my patients, and can it help me as a runner, and does it help with aches and pains, things of that nature, recovery. So that's why I really wanted to bring Laura on here today. And actually, in our physical therapy annual state conference, we had a big presentation on this, and the big take-home message that I learned from the presentation was that this is coming, and it's coming fast and furious, and most of you, so the general public, is wanting these products, this information. So whether or not we're ready for it, a lot of this is coming, and I'm trying to educate myself so I can be able to help my patients and give them informed and educated opinions and information on what is actually out there regarding CBD. So with Laura being a licensed physical therapist, I figured this was a good opportunity to kind of educate. Mike, what's up? Good seeing you. Kelly, thanks for jumping on here. So let's get into our first question. I guess the main question, or kind of the big overall arching theme, is what is CBD?
Okay, so as Dwayne was saying, if you're driving around in your day, you will see CBD signs everywhere. Gas stations, nail salons, coffee shops, ShopRite, Aldi's, it's everywhere, and everyone's, seeming to purchase it pretty much anywhere they're finding it, which is a really scary thought. But I just want to share a little bit about what is CBD. CBD is a cannabidiol, and it actually is one of 113 identified cannabinoids that come from the cannabis plant. So to kind of really break it down very simply, there are two primary species in the cannabis plant. One is CBD and one is THC. So if you kind of have like the main plant and these are the two branches, the THC, which is what everyone knows as marijuana, is tetrahydrocannabinol, and that is the psychoactive ingredient that will, and the euphoric component. So that is where people get high, and that is when people use marijuana, they are using the marijuana for the THC and euphoric effect. So that's one species of the cannabis plant. The other primary species is CBD, and that it comes naturally as a compound that naturally comes from the hemp. So that is the non-psychoactive portion of the cannabis plant. Now, we're not really going to be talking about the THC medical marijuana per se, because we're trying to use it for health and wellness, not for the psychoactive ingredient. But the one thing that people really are confused about is hemp may have up to 0.3% THC in the product. So in the plant, you may have up to 0.03% of THC, which is a very, very small amount. But we'll talk about this a little bit later. Is it legal? Will I pass a drug test? Because that's really important when we're talking about those a little bit later on.
So I'm sorry, can I just interject
Absolutely.
for 1 second? Just because you mentioned the word hemp, and I've heard that a bunch of different areas, and I really didn't understand what hemp was. So hemp is a part of the plant, or it's an ingredient inside the plant?
The compound that's found naturally in the hemp plant is the CBD.
Oh, okay.
So the cannabidiol comes from hemp.
Okay.
It's a component of the hemp.
Okay. All right.
So you have the THC, which is the marijuana. That's one of the primary species of the cannabis plant. And then you have the hemp. So it's like two different components of the plant. Okay. And then the CBD comes from the hemp.
Is located in the hemp. Okay. All right.
So it's kind of like a, like a main root, and then the branches come down. So what we are seeing now in the stores and everything is obviously not marijuana. It's the hemp. And the reason why you're seeing this and the reason why we're seeing this so prevalent in the last couple of months is because in December of 2018, the Farm Bill was passed in the United States, and that allowed hemp to be legally sold, which is obviously where the CBD comes from. So CBD is legal to be sold as of December of last year. That is why you're seeing this now occurring in stores and gas stations and hair salons and coffee shops. So because it came legal, because it had a very small THC component in it, they allowed it to be sold in the United States. So the important thing to understand is if you are trying to use if you're looking for the psychoactive effect, the CBD is not what you are looking for. If you're looking for the botanical healing properties, then CBD is what you're looking for. CBD basically, it works kind of like it works with the endocannabinoid system, which is a huge community of cell receptors in the body, and it's one of the largest neurotransmitters. And we're not going to get into much of a scientific background, but basically, it's the body knows. It's like an adaptogen, the CBD. The body knows what is lacking in the CBD receptors and endocannabinoid system, and it's able to improve the function of wherever you're having some dysfunction. So that's kind of like a broad, basic of CBD. It's a little confusing, and the terms are so intermingling used with people. It's important for people to understand that the CBD oil comes from the hemp, non-psychoactive. The THC is the marijuana.
Nice. No, I think that summed it up, gave us a general. I think if you went any more in depth, honestly, you'll lose me.
Yeah.
So,
so it is a lot.
Because I understood that. So that's good. So,
Okay.
Mark, thanks for jumping on here. Amy's here on the live. Thank you for jumping on. Guys, if you're coming here on the live, just type in live into the comment box. And if you're here watching this on the replay and you are interested in having your question answered by Laura, who is our CBD expert, type it into the comment box. We'll be happy to answer any of your questions that you have here on the live. So, Laura, what are the benefits of CBD?
Okay, so this is the easiest part of the live. It's a little confusing to, get the main terms down. But basically, from what I've seen clinically with patients and also just with customers and family and friends, is the most helpful thing I found is tremendously helpful with anxiety and depression. So for people that suffer from anxiety and depression, the CBD oil, because it comes in a cream and it comes in an oil, 2 different ways of delivery and for many different reasons. But the anxiety and depression, the CBD oil is wonderful for. I have seen people that have been on psychotropic medications for 20 and 25 years that have been able to titrate some of their dosages down with the use of CBD. So very helpful for anxiety, depression. Very helpful for sleep hygiene. For people that suffer from poor sleep habits and insomnia, it is kind of like a decompressor. So it helps with de-stressing people. Therefore, they have less anxiety and depression. It also helps increase the serotonin levels, which just makes you feel a little bit calmer. So that, therefore, people have better sleep. So it's really helpful with sleep, anxiety, depression, pain. It helps elevate your mood, mental clarity. People can focus a little bit easier. There are people that are very distractible and find with taking the CBD oil, they're able to focus on their task better. The benefits of the CBD really are pretty broad because the endocannabinoid system works with every cellular system in the body. So the benefits are really a very, very long list, but what I have found mostly, anxiety, depression, sleep habit, and also seizures. It helps prevent seizures. So a lot of patients or people that have epilepsy have used the CBD to decrease their episode of seizures.
So for those runners who are watching this right now, if you guys have ever experienced any like pre-race anxiety or difficulty sleeping, just type in sleeping into the comment box, because I know that is a common pain point that I hear from a lot of my running clients, is being able to calm down prior to a race especially, and getting a good night's sleep. And sleep hygiene is very, very important for you as a runner, especially if you are looking to perform at your highest potential at a race. So Mike, thanks for jumping on here. Mike's here on the live. Amy is here on the live. Thank you for jumping on here. So I know we talked about some pain relief. Is there any benefit because I see a lot of runners who suffer from overuse injuries, such as Achilles tendonitis, plantar fasciitis, knee pain, hamstring pain, right? So a lot of like inflammatory kind of conditions, overuse. Any benefits for CBD in terms of inflammation?
Yes, I actually had a feeling you were going to ask about running injuries, so I kind of saved those specific benefits for your question. So one of the things that they have found with CBD, I just want to preface this whole live with that CBD does not cure anything, doesn't cure injuries or diseases or illnesses, but it helps support the symptoms of those diseases and health-related issues. So, people say, that person said, if I take CBD, I'm all set. It really helps support the body to be as well as it possibly can. So with running injuries specifically, CBD has been found to be very helpful with reducing inflammation. And inflammation, as you know, is very related to chronic injuries, which is very common with runners. Because most runners are doing it very consistently, if not every day, sometimes multiple times a day if they're, training for a specific event. So there's a lot of overuse injuries. So the reducing the inflammation is very helpful. As Dwayne was saying, decreasing your stress level is going to be helpful because when you have less stress in your body is going to work more effectively. Getting better sleep. Whether you're not injured or you have an injury, if you are not sleeping well, your body is not working optimally, and you will take a little bit longer to heal. So people underestimate the importance of stress and sleep in just about every recovery system for the body. So the CBD is really helpful. And with the inflammation, they have found studies that have been using runners that do long distance, and they actually found that they were able to use much less of the nonsteroidals with recovery from injuries when using the CBD. And a lot of people have issues with the nonsteroidals, ulcers, stomach issues, sometimes increased blood pressure. So the CBD seems to be able to get people off taking some of the things that cause other harmful effects, some of the medications. So it's been very helpful. Wouldn't say it would cure an injury, but it certainly would help with the recovery time.
Yeah, so just for some of you guys who are not familiar with the terms like NSAIDs or nonsteroidal, so that's basically your Advil, Aleve, Motrin. So if you are taking that from a chronic standpoint, that's definitely not great for your GI system. Mm-hmm. So there are a lot of side effects that can happen by taking those long term. So perhaps CBD may be kind of something that can help in that respect, as opposed to taking those NSAIDs. One thing that I like that your mindset is that CBD isn't the kind of the magic bullet, mm-hmm. right? And like the cure and end all be all cure, because definitely I think, especially I find that as a runner, there are a bunch of people who are looking for the quick fix. And if you are suffering from Achilles tendonitis, plantar fasciitis, hamstring pain, hip pain, right? Front of the kneecap pain, those things aren't going to get better with one specific treatment per se. There's certain treatments that will make you feel better in the short term, but really addressing what caused it is key, whether it's training errors, whether it's muscle imbalances, whether it's your running mechanics. Shoe wear, right? You're not replacing your shoes. So there's multiple factors that go into why you do have pain, and you shouldn't ignore it. So you should definitely get it checked out and treat that pain. So I like that you kind of brought that point up. So one of the things, hey Lewis, how are you? Thanks for jumping on here. One of the things that kind of you brought up earlier is with CBD, and it's not exactly the THC component. And you did mention that, so last mm-hmm. December, from mm-hmm. what I've heard, mm-hmm. CBD became legal. Correct. Now, is that nationwide or is that in Connecticut?
No, that's in all the states.
Oh, okay.
As of now.
Okay.
When that farm bill passed, it made it legal to sell the CBD.
Okay.
So basically, it's available now in all states in this country.
All right. So if someone maybe is watching this and maybe they're a public servant, maybe they're a firefighter, maybe mm-hmm. they're a policeman, mm-hmm. and they have to get drug tested for their job, mm-hmm. And they take CBD, could that possibly come up positive in a drug test?
Yeah, so this is really where, when you're thinking about using CBD, or if you have been using CBD, and a lot of people already have, that really have not educated themselves, probably the most important thing I could leave this interview with is, if you are using CBD products or you are thinking of using them, please educate yourself on what it actually is, what you're looking for, the benefits are, and if you are with the company that is really providing the best product for you. Because right now with CBD, the company that I'm partnered with does not have any THC. It's not less than 0.3%. It's 0.0 THC. And the only way you would know that with the company that you're using your CBD products or your store is if you have a certificate analysis from that organization or store or company proving that you absolutely do not have what you don't want in the product. So if you just got hemp from a store and it says, less than, trace THC, you could definitely test positive on a drug test. So there are companies like the one I'm partnered with. We have chosen to have 0.0% THC, and we have a certificate of analysis, which is critical to have if you're going to be using this product to know what you're using, that shows that it does not have any THC. We've had the product since January, And we have many brand partners and customers that are firemen, they're truck drivers that get randomly drug tested, and that has shown up negative on all of them. But if you are using a CBD that may have that 0.3% or less, it will be a trace positive in the drug test. So you really have to be careful of what product you're using if you're likely to have a drug test for your job.
Yeah, and the presentation that I went to at conference, that was kind of the big talking point too, is that since this became legal, there are all of who's who is jumping in the market to sell this product to the public and trying to make a buck, and it's like the wild west. And right now it's not regulated, right? So you do want to go with a company that actually does some independent testing and test the product to know what's exactly in it, versus just going to your store around the corner and you're not sure what is actually in the product. So that was a big take home for me at the conference, was that you need to know and have some lab tests to know what's actually in the product. So if you guys think about like all the stuff that's going on in the news with the vaping and like all the terrible stuff with that, I think that in of itself as well is linked to a lot of all this, black market type of, you don't know what's actually, these kids and these people are vaping. So, I think CBD, you do want to just make sure you know what you're putting in your body. If you're taking the oil or, you're using the cream and you're putting that on your body and it's getting absorbed into your body. So I think that is a good point. Cindy, thank you for jumping on here. Good to see you. So guys, if you have any questions, I know we kind of caught you kind of off guard on a little Friday kind of happy hour. You might be driving home from work right now. You might be stuck in traffic. You might still be at work right now, but we will definitely answer any questions on the replay. So those of you who are watching this on the replay, as well as on the Spark Your Training YouTube channel, type in your questions into the comment box and we will definitely get back to you. So if some people wanted to learn a little bit more about CBD, the different products, the oils, the creams, kind of talk to you about their specific scenario, whether they have a certain medical condition. How can people get in touch with you, Laura?
Okay, so you can Facebook message me. I'm on Facebook. I'm in the Healthy Runner group with you guys. So I'm a member of the group. So you can just reach out to me, I think, via Facebook message. And you certainly can email me or text me. If it's a Facebook message, I'll certainly give you my number. Just say, hey, I have some questions. I'm a communicator. I talk to people. So I will actually prefer a phone conversation versus texting back and forth. And just one other thing I actually forgot that's really important. This is really huge. Hemp, by nature, is very poorly absorbed in our bodies. That's just the way it is. Certain botanical products don't absorb well, and so the absorption is really poor with hemp. So that's why you see so many high milligrams. When people say, "Oh, I'm on 1,000 milligrams of CBD," usually the absorption rate is between 6 and 13% with the hemp. So if you're taking 1,000 milligrams, you're absorbing only between about 60 and 130 milligrams. That's why the milligram dosages are so high. So the company I'm partnering with happens to use liposome technology, which really increases the absorption. It's like a fat bubble, and it puts the CBD oil in the fat bubble, so it bypasses some of the digestive enzymes that break down the product. And so the absorption rate is up to like 90 to 95%. So the absorption is really important. You don't want to be on 3,000 milligrams of anything. You want to be on less if you can. People think the more you're on, the better off you're going to be. Less is usually always more when it comes to anything you're putting in your body. So you can reach out to me anyway. And also, we're actually having a presentation at the Playwright in Hamden this Monday from 7 to 8. We will have the cream and the oil to sample if you want to try it, if you have some musculoskeletal aches. The cream is more for like topical aches and pains, and the oil is a little bit more for central driven dysfunction. So I'm pretty available. I'm really excited about this. It's something that is going to be around with everyone. You're going to run into it with friends or family members, and even kids are asking their parents about it, and most people really don't know. So if I can help you in any way with some education, I'll be available.
Yeah, well, we definitely thank you. So here in the Healthy Runner CT Facebook group, we definitely want to share well-informed information with you, whether it's injury information, whether it's healthy running tips, whether it's nutrition. And that's why I wanted to bring you on here today. And I think you did a really good job at kind of sharing that with us. And, just informing us, right? Being more of an educated consumer, we need to know how to take care of our bodies. And I think everyone in this group, and that's why you're here in this group, it does want to take care of their bodies as we begin to age, right? We want to age gracefully, and we want to stay active. We want to stay, healthy. And so hopefully this information was helpful for you. If it was, guys, hit that like, hit the love button. It will just help this information reach more people on Facebook. So we want to get this information out there, get some good, high quality information like Laura provided us here today. So hit that like, hit the love button, share this out with one of your friends who is wondering about CBD and was asking some questions about CBD. So thank you again, Laura, for taking the time out of your busy day and busy schedule for jumping on here. And thank you all for those of you who had tuned into the live. And thank you for those that are watching on the replay. And if you did catch the replay, type in Team Replay into the comment box. And those that are watching on YouTube on the Spark Your Training YouTube channel, greatly appreciate it. Hopefully you found the information helpful. So this has been a Monday Night Spark on a Friday Happy Hour special edition. All right. Have a great weekend, everyone. Talk to you soon.
Okay.
Bye.